and I'm excited to hear more about what's going on with Oratel Diagnostics. We've spoken before with stories in the Startup Health magazine, but now I get to get an update, a 2020 update. So
2020 update.
2020 update, right?
Right.
So why don't you start by telling our audience what Oratel Diagnostics is all about right now?
Well, Oratel Diagnostics is focused on addressing pelvic pain in women, particularly adolescents, because 50% of that pelvic pain is due to endometriosis. Okay. And endometriosis occurs when cells like those that grow in your uterus go elsewhere in your body and cause tremendous pain and also cause fertility. Okay. So we have a really simple little test. We use saliva.
Let's make sure that we can see it in the camera here.
Put it right in your mouth.
Okay.
And then we can read it on an app that we've put on our iPhone. So I have to hold this to you.
Yeah, I'm going to hold it for you. You can talk.
Yeah, just a second. I got to get the right thing here.
So you swab.
Yeah, you swab.
You swab.
I'm doing this.
This is a test for endometriosis.
And you can test it right on this stick. It reads the color. Here we go. It reads the color, zap, and it gives you a number. And if the number is close to 0, you don't have endometriosis. But if it's close to 1, there's a 92% chance that you have endometriosis.
So you invented this. Is there anything else like this in the market?
This was an accidental discovery.
Okay.
Actually, we're making use of nature.
Okay.
You know that flowers have a lot of beautiful colors that attract bees and butterflies and birds. Well, we use those colors not to attract those birds, but on our skin. The skin has surfaces that have different kinds of sugars that change with the hormonal cycle. And these pigments pick that up. And we can read that with an iPhone, and it gives an instant answer.
And you made that connection between the colors of flowers and into endometriosis diagnosis on a phone.
This was because
I'm impressed.
I'm one of those crazy people who likes to learn new things. And I was a Peace Corps volunteer in Nepal about 50 years ago, and we ran out of litmus paper and we started using flower pigments.
Really?
And then I started teaching classes in my home called Cooking and Chemistry, and we decided to explore saliva. And I noticed this periodicity that goes every 24 hours. And I started measuring my body fluids, and I noticed I could pick up fertility. Now, fertility is not something that people really, at least people, maybe cows put money into it, but not people so much. But what happened was there were some people in my neighborhood who wanted to get pregnant and use my test.
Really?
And they gave a completely different answer. And they all had endometriosis.
Wow.
And I thought, this is really important. I should do something about it. So I called the Endometriosis Association, and they got me started.
Wow, wow. Okay, so take me behind the curtain. Talk to me about the product. You've shown me the product,
but
where does it stand? Where does it stand in terms of rollout?
When this came into existence.
The phone.
And I mentioned that we started 50 years ago. You can imagine all the time it took to get to the iPhone. The iPhone revolutionized our technology.
Okay.
And we are now able to make these tests. We not only use them for endometriosis, but we use them for cows and farms.
Okay, explain.
And we can tell ahead of time before breeding when a cow will not get pregnant. This is money in the bank for the farmer.
Okay, all right. So you're helping to solve endometriosis with a mobile app,
yeah.
But you're also helping farmers
yeah.
Breed cows.
Yeah.
Fantastic. I feel like you are a problem solver extraordinaire.
Well, there are a lot of great people out there to help.
Yeah.
I've met some companies in different countries, and we're working in partnership. And they are the ones that make these kits now. And the farmers are stepping forward. They're going to be the salesmen. And I've got a team working at Brigham Women's. We have clinical trials going on right now.
Fantastic. In 2020?
Yes, right
nice.
now. They just started last week. And a group in Los Angeles called CTIP, Center for Pediatric Technology, they've invested in us.
Fantastic.
So we have come a long ways.
I love it.
But it comes also with Startup Health.
Awesome.
We met these people at Startup Health.
That's wonderful to hear. I love hearing your story of how your curiosity blossomed, combined with your study, your knowledge, to blossom into multiple multiple layers of problem solving. So,
but do you know, it just didn't come from me. It came from all the people who are doing work on this.
Sure.
People who are working in the patient recruitment, people working with doctors. What's important here at Startup Health is engaging with the people who know how the payment system works, how to do clinical trials, how to go through regulatory process. I'm meeting tons of companies here that are going to be helpful.
I'm so
in the
glad.
future.
I'm so glad. That's all the time we have. Dorothy,
thank you
so much for telling us about where you're at with Oratel, and I hope it's an awesome rest of the day
Thank you very
for
much,
you.
Logan.
Okay.